There are two key ways to reduce the cost of health care for farming and ranching operations. However, if a producer is enrolled in Medicare, there can be additional elements to that process. Roger McEowen with the Washburn School of Law joins us now with the details. Roger, thank you so much for your time today. Let's start with a look at the two methods at hand.
Good to be with you, Tammy. What I'm talking about here are health savings accounts and Health Care Sharing Ministries. And you can deduct contributions to a health savings account, and the account earnings grow tax-free, and your distributions to qualified medical expenses are also not taxed. So that's a triple tax benefit. Deduction as you go in, growth tax-free, not taxable income on the way out to pay qualified tax benefits. And you really can't find that hardly anywhere else in the entire tax code. Now, healthcare sharing ministries, those are organizations where the members share common beliefs, and they also then share their medical costs. So it pools you with people with common interests, and typically those are ones that have lower healthcare costs to begin with. So the members contribute a monthly amount, and those funds help pay for other members eligible medical expenses. And that can also be a great way to reduce the cost of what would otherwise be paid for health insurance.
Yeah, I've been hearing a lot about those. So what about if a farmer or rancher is enrolled in any part of Medicare?
Well, once you enroll in any part of Medicare, you can't contribute to an HSA, but merely being eligible for Medicare doesn't prevent additional contributions. So there's that time lag between becoming eligible, perhaps, and then at the time you enroll. Now, you can contribute to your HSA past age 65 if you delay enrolling in Medicare. And if your spouse enrolls in Medicare, you can still contribute to your HSA if you aren't also enrolled in Medicare. And even after you enroll in Medicare, you can still withdraw the funds from your HSA to pay for qualified medical expenses. And you can use the account funds to pay for various Medicare-related expenses, including your premiums, your deductibles, your co-pays, your co-insurance. And once you reach age 65, you can still withdraw the funds from your HSA for any reason without incurring a tax penalty. But those withdrawals are subject to tax.
So now, are there restrictions with the Health Care Sharing Ministries?
There are. Those are not like traditional health insurance, and they may have restrictions based on the plan on what they cover, or based on the ministry, I should say, on what they cover, such as pre-existing conditions. Now, the healthcare sharing ministries don't typically coordinate benefits with Medicare in the same way that traditional insurance plans do, and that's an important point to keep in mind. So if you have Medicare, it'll generally pay for Medicare covered services first. Then your healthcare sharing ministry might help with some of your out-of-pocket costs that Medicare doesn't cover. But it really depends on the specific rules of the health sharing arrangement.
All right, that is good advice. That's Roger McEowen with the Washburn School of Law. Thank you for your time today.